Hi everyone, welcome to the channel. There's a lot of things that we can do to improve our health as we get older, but what about our heart? Well, today I want to share with you 3 amazing advances that are going to help keep your heart healthy as you age. Now, the first one is called cardiac rehabilitation. This has been around for many years, but it is constantly being refined. And here's how this works. If you have had a heart attack or a procedure such as a stent or a bypass surgery, there are certain recommendations that your doctor may make to help you recover better. These could include exercise, nutrition, counseling, and medications. However, not everyone follows these recommendations. So this is where cardiac rehab comes in. Cardiac rehab is when you work closely with a team of professionals that includes doctors, nurses, dietitians, and physical therapists. They will develop a plan specifically tailored for you based on your needs. So if you need to increase your exercise, they're going to work with you on that. If you need to change your diet, they're going to help you with that as well. Now, why is this important? Because studies show that people who participate in cardiac rehab have a 25% lower risk of having another heart attack or cardiovascular event. And they also have a reduced risk of dying from any cause. In addition, cardiac rehab is not just for after a heart attack. Many people who are living with heart disease and who are not having symptoms may also benefit from cardiac rehab. The main goal is to help you make changes to your lifestyle so you can live a longer, healthier life, despite having heart disease. No, 2. Another exciting advance that's happening in senior heart health is artificial intelligence, or AI. It's helping to diagnose heart problems earlier than ever before. AI is already being used in some hospitals to analyze a patient's symptoms and medical history to help doctors diagnose heart problems more quickly and accurately. For example, AI algorithms can be trained to recognize patterns in a patient's ECG, or electrocardiogram, which is a test that measures the electrical activity of the heart. By analyzing the ECG, I can help doctors identify people who are at risk for atrial fibrillation, which is a type of irregular heartbeat that can lead to stroke. In addition, AI is being used to develop new ways to monitor heart disease. Example, some companies are developing apps that use AI to analyze photos of a person's face to identify signs of heart disease. Other companies are developing wearable devices that can continuously monitor a person's heart rate and other vital signs. By using AI to monitor heart disease, we may be able to catch problems early and prevent them from becoming serious. As AI technology continues to develop, we can expect even more exciting advances in senior heart health. The third advance that's happening right now in senior heart health is in the area of artificial heart valves. For those of you who don't know, the heart is a pump and it needs valves to keep the blood flowing in the right direction. When these valves become damaged or diseased, the heart must work harder to pump blood, which can lead to heart failure. One way to treat this condition is to replace the damaged valve with an artificial one. Now, in the past, the only option for an artificial heart valve was a mechanical valve made of metal or plastic. These valves last a long time, but they require the patient to take blood thinners for the rest of their life, and that increases the risk of bleeding and other complications. But today, we have another option, and that's a tissue valve made of animal tissue. These valves are more like the valves found in your body naturally. They're made of a strong material called porcine, which is taken from pigs. The valves are then treated so that the body does not reject them. Now, this is great because tissue valves do not require blood thinners, and they last for many years. In fact, research shows that most tissue valves last at least 10 years. That means that many people who receive a tissue valve will not need to have their valve replaced during their lifetime. This is a huge improvement over the mechanical valves, which tend to last much longer. So far, these valves are working really well. In fact, 95% of patients who receive a tissue valve are alive and doing well 10 years later. So these artificial heart valves are a major advance in treating heart disease. They give people with heart disease the chance to live longer, healthier lives. As we get older, it's natural to worry about our health, especially the health of our hearts. But thanks to advances in medicine, we have more options than ever to keep our hearts healthy as we age. From cardiac rehab to AI-powered diagnosis tools to artificial heart valves. By taking care of ourselves and working with our doctors, we can all keep our hearts healthy for years to come. I hope you enjoyed learning about these advances in senior heart health. If you want to learn more, please visit the website below. You can also comment below with any questions you have. We have a team of experts who will be happy to help. And don't forget to subscribe for more videos on healthy aging. Thanks for watching.